The following program is for informational and educational purposes only. This program does not replace medical, mental health, or psychological diagnosis and treatment prescribed by your personal physician, psychologist, therapist, or other healthcare provider. Please consult your provider for diagnosis and care before beginning or changing any program or idea discussed.
Welcome to Recovery, the Hero's Journey. Your host is Dr. Patricia Halligan. If addiction or prescription drug dependence affects you, directly or indirectly, whether it's you, a family member, or a close friend, stay tuned over the next hour as we explore substance use disorders, process addictions, and prescription drug dependence. We'll be discussing the painful reality behind these disorders and what can be done to help. Now, here is Dr. Patricia Halligan.
Hi, I'm Dr. Patricia Halligan. Several of my podcasts have focused on the epidemic of benzodiazepine overprescribing. Benzodiazepines are sedative hypnotic drugs like Xanax, Ativan, and Klonopin. They are only supposed to be prescribed for 2 to 4 weeks. However, doctors prescribe them for years. These are dangerous drugs. What you need to know is this. 1 in 3 patients will experience benzodiazepine harm to their central nervous system, and 1 in 3 may experience severe withdrawal that may last months to years and may ruin your life. I feel honored to have Geraldine Burns on the show today. Geraldine is an absolute giant, a pioneer, and a tireless advocate in the promotion of benzodiazepine awareness and the fight against benzodiazepine harm. In 1999, she started the first internet support group for people wishing to withdraw from tranquilizers or already off and having problems. She was instrumental in having Professor Heather Ashton write her manual, Benzodiazepines, How They Work and How to Withdraw, also known as the Ashton Manual. In 2006, Geraldine launched the website benzobookraeview.com. It was started after she was given the rights by 11 internationally known authors of books that had been written on the subject of tranquilizers. She has done a number of radio shows, including Prescription Addiction Radio, The Frankie Boyer Show, Dr. Gloria Gilbert's Your Health Matters Show, and Blog Talk Radio. She was the United States representative for World Benzodiazepine Awareness Day until 2019. Her advocacy work has been filmed from 2014 to 2020 for the upcoming documentary, As Prescribed, due out in 2022. It's a documentary film project about benzodiazepine dependency and discontinuation syndrome. In 2018, Geraldine and her son, attorney Garrett Burns, launched her podcast, Benzodiazepine Awareness with Geraldine Burns, also available on YouTube. Geraldine, welcome to the show.
Thank you for having me, Dr. Halligan. I really appreciate it.
My pleasure. Now, you've described yourself as a behind-the-scenes kind of person, and I'm wondering, how on earth did you end up front and center leading a crusade?
Well, you know, when you have a normal life and you're working and you're a young mother, and all of a sudden, when I had my second child and I said I didn't feel well, I'm given Ativan right in the hospital. Now, mind you, I didn't take it. And then they kept trying to figure out why I didn't feel well. Because I had no fever, eventually I was sent to a psychiatrist. And even then, I kept saying, nothing's wrong. I'm not depressed. I just have this heavy feeling. Mm-hmm. So finally had my daughter in March. By August, I finally take it. And I have to say, I got a little bit of relief, but it didn't take the heavy feeling away. And now I start developing anxiety, panic attacks, agoraphobia. You know, my life is, I want to go back to work and I can't go back to work. Something is wrong with me. So to make a long story short, eventually within a year, I did find out I had an infection after childbirth, took an antibiotic, felt wonderful. In 5 days, even my husband came home. He's like, you look so different. And I stopped taking the Ativan. Why did I need it, right? But I don't realize back then there's no internet. You can't just stop taking it.
And nobody had told you that when they prescribed it in the beginning.
Exactly. And when I called the doctor to tell her what happened, she said to go to an emergency room and never questioned her again that I had to take Ativan for the rest of my life. In fact, all through my records, as she's given me other drugs, and thank God I reacted to all of them, And the other thing is my period is changing. I had perfect periods my whole life. And each year that I'm on it, my periods are changing. But at one point, by 1992, I'm so ill and non-functional that a friend sends me to a holistic nutritionist, and I go to him. He changes my diet, gives me very minimal supplementation for my body. And at that point, she had me on Elavil and Ativan. Got off the Elavil without a problem. And I'm coming off the Ativan. I don't even know tapering. I still don't know it's the drugs. And I go back to work part-time. I'm on call. I love it. And so 7 months I'm doing the diet, and I'm losing the drug weight, because sometimes you can get that drug weight. And, and she said, diet and nutrition have nothing to do with your health. And stupidly I said, so I can have sugar again? And she said, absolutely. And I sold my soul for sugar. So back up on the Ativan I went, and she constantly kept trying to give me, other drugs. Nothing ever helped, it's just pretty sad. So it wasn't until when I'm turned 41, the bleeding is so bad, it's now 3 weeks out of the month. And I don't know what's going. Yeah.
That's terrible. And you're how old?
41, and I wanted to have more children. So from 33 to 41, I'm watching my periods change constantly, bleeding more and more and more and more.
8 years on Ativan. And what was the average dose?
So I started at 0.5 milligram, and I kept reaching tolerance. So I'm having interdose withdrawal, and I'm reaching tolerance, and she's never explaining it to me. And I'm saying to her the whole time, because I have my records, I kept saying to her, I think it's the Ativan making me sick. And she said, no, you take it as prescribed. Therefore, you are not having a problem. And, it was just ridiculous. So by 41, I have a hysterectomy. And 6 months later, I meet my new gynecologist. And I say to her, I take this Ativan and I can't be without it. And she turned with horror, and she said, you're on one of the most addictive drugs ever made. And it was like, there was my light bulb moment, that it was making me sick all those years. And so, but she hands me a slip to come off in 2 weeks. I'm on 3 milligrams at that point, and it's like come off in 2 weeks. She didn't know. But
at least she knew it was addictive.
She knew it was, yeah. And then I had become dependent on it, right?
So that's when you start connecting the dots.
There's the mysterious, there's everything. I saw gastroenterologists, cardiologists. I mean, you name it. I was running to doctors for years. Once I knew it was the drug, I was done. So I found one little book back then. This is like back in like 1996, 97. And it says it could take about a year, but I figured, all right, I'll taper slowly. Well, my slowly, again, when somebody tells you 2 weeks, I came off in 4 months, and that was pretty brutal,
Oh, I can't imagine. And the average dose that you were on, the average milligrams per day?
In the end, 3 milligrams.
3 milligrams
started
over
at
4 month period withdraw. Yeah. Oh, yeah. Wow.
It hurt.
And did you taper from the Ativan itself?
Yeah.
Okay. Taking little small chips.
Well, again, I back then I thought, I was cutting from my morning. I thought, I'm going to set it up by 7 and 7 or 8 and 8. I stayed within an hour, right. And I was cutting like from my morning dose and my evening dose. Oh, good God, it hurt.
But nobody was helping you. She said 2 weeks. So in your mind, you're thinking 4 months is a long time.
Yeah. And then I slowed it down a little bit at the end. And, but it's like I'm calling around, and, I'm calling Mass General, I'm calling Brigham Women's, I'm trying to call for help, and nobody is giving help for anything. And, so. And
that's the smartest community that I know in America, medically speaking. That's where all the smart people are.
Yeah. Well, at one point, Mass General actually had a benzodiazepine taper program that they tried, but they would only take you if you were on Xanax and Klonopin. And so later on, when I talked to the doctor that was running it, he said, well, we would have taken you on the Ativan. I said, well, do you teach any techniques? Do you talk about food? Do you teach any breathing? Do you do anything to help people, calm down? He said, no, we're tapering them. And I do know that where he has gone to work now, that they're actually, I see them all ordering the Ashton Manual. So,
hallelujah.
I think they're, all these years later, they're well versed, but he actually prescribed to one of my childhood friends. She went in her early 20s, with a migraine, and walks out with 3 milligrams of Klonopin and 150 milligrams of an antidepressant. And 40 years later, she's now tapering. Everybody just kept prescribing, even after he left, just kept prescribing to her.
I have a patient of mine who listened to one of your podcasts and immediately called her niece, who had just been put on Xanax, and said, "Get off it now." I think the niece had been on it for 3 weeks and she stopped the Xanax, and danger averted. So this is information that just has to get out.
It has to get out. We have tried very hard here in Boston. So one of the things that happened is, as I'm going through this, and you realize it's the drug that took my career away, and I'm thinking, oh, I'll be back to work in a year. I started to write a book. I'm thinking, this is insane. This is crazy that, I'm calling doctors in Boston. They're saying no such a thing, or it was out of your system in 2 weeks. It was out of your system in a month. And here I am experiencing it. I don't drink. I don't smoke. I don't even drink coffee or tea. I just drink water and occasionally a little pomegranate juice. Like, that is it.
You're a healthy person.
Yeah, I was, I became healthier.
Ativan.
I became healthier because of Ativan. I have to say, you never meet one of those people that was always thin and active and could eat anything they want. Well, that was me. So I now, I make sure I'm eating healthy. I'll cheat every now and then, but you realize this is the one body we have to go through life. And I learned the hard way. You're tortured. There's no other word for when you go through this but being tortured.
Well, this is where I've got two epidemics on my hands as an addiction psychiatrist. One is the opioid epidemic, and one is the benzodiazepine epidemic. At least with opioid epidemic, I can give somebody buprenorphine and stop their withdrawal. But there's no FDA-approved medication that I can give somebody who's in active withdrawal. And they ask me, Geraldine, all the time, what can I take that stops the akathisia, and what can I take for the insomnia? What can I take for the headaches and the tinnitus and the abdominal cramping and the high levels of anxiety and irritability? And you are right. It is torture that doesn't end, correct?
Correct. But I've seen over the years when we've had people who have tried to taper, and I don't ever call it failing. And then they're going to try again, because again, they have to have a life or they don't have support. I had phenomenal support.
Did you?
I had phenomenal, not only, my mother, my siblings, my neighbors, my in-laws, my nieces, my nephews, everybody. It was, very supportive. So my kids were 10 and 14 when I learned. So that's young. And now they knew I couldn't do a lot of things before, but now I said, hey, I'm going to come off these drugs. I'm not going to be feeling well. I mean, they saw me suffering, And
what's the worst moment? If you could paint us a picture of the height of the withdrawal.
So the height of the withdrawal, I mean, there were hallucinations. There are thoughts of murder. I mean, I'm very honest with what I went through. So It's funny because my kids' friends would say, did you ever think that about me? Like my husband or my two kids, if they walked by me, I would have a thought of stick a knife in them. And I know many that have had to have all the knives taken out of their house. These drugs have altered your brain. So somebody say, oh, that's mental illness. Nope, didn't have it before.
Nope,
it's full-time mother. Yes. Never had a problem.
I had a patient who had the same obsessive, intrusive, distressing thought, and she didn't have OCD. And the thought was intruding on her consciousness. She had breast cancer, and she was anxious, of course, going through chemo. And they put her on Klonopin. And within 6 months to a year, these intrusive thoughts about, I'm going to get up in the middle of the night and stab my family. She's never been violent in her life. This was just because the benzodiazepines changed her CNS.
Changed the brain. The intrusive thoughts, I think, really bother people because these thoughts that come in are horrific. I think the other thing for me, when I first called over to England, one of the first things they ask, because again, I'm getting no help here. My son says you have to find others like yourself. So when I called over to England, they mentioned having the mood swings. Well, the mood swings, it was like I was the exorcist, horrible. I'm thinking, what is happening to me? I'm so easygoing, you know?
This is not you.
No, it really changes you. So I remember somebody locally here as her daughter was going through it and she was swearing and cursing. I'm like, look, she should apologize when she comes down, but don't take offense to it. She will come out of this, and you have to almost explain to the family. So it's very hard. It's so unreal, actually, what you go through. And yet everything you feel is real. And even though somebody might have had something that I didn't, doesn't mean it isn't real. We've seen some I can remember, and I've said this on one of my podcasts, one of the women had the sensation of a meat hook up her rectum for 14 months.
Oh,
she went
that's
everywhere.
excruciating.
And then one day just gone, but had it for the 14 months.
Right. Such a rare, not talked about symptom, but right. It can damage the CNS in so many different ways.
Yeah.
Now, when you called England, who did you talk to?
So I first, my son found CETA, which Pam Armstrong and Peter Ritson started at. Pam was a nurse who saw the need. Peter was a victim, and he wrote a book, Alive and Kicking. Pam wrote hers. And so she was a nurse who had amazing acupuncture skills. So when you went to CETA, which is Council for Involuntary Tranquilizer Addiction, which then they changed the name, and that organization is gone. Pam passed away, and then her husband took it over, and then he passed away. So that organization gone. But when you went there, you were given free auricular acupuncture. And one of our women who went through tranquilizer withdrawal, her husband was a pilot. She actually flew to Hong Kong for acupuncture and said Pam's auricular acupuncture, she got the best sleep she ever got. So Pam was doing things to help the body so that you're not just struggling and you're doing a slow taper.
Mm-hmm. How wonderful. Yeah. And now you started in 1999, the first online support group. Tell me a little bit about that startup.
So I was slowly meeting others online. So I think at that point we had 24 of us from South Africa, from England, Canada, United States. And somebody said we should have a spot where everybody can go together. Yeah. So we did. I started it with 24 of us. And then all of a sudden it just starts growing to 100, 200, 1,000, 2,000. I think by the time it got to 4,000, at that point, Dr. Grisanti had said, look, with the manual, we now had the Ashton Manual. Heather had written, Professor Ashton had written that for a book I was doing. I was doing it on a whole international level. I was getting information from Sweden, from Australia, from doctors. And not that all those countries are doing better than us, but they had more than us. When I called over to England, the first person I spoke to, he said, you Americans should be ashamed of yourself. We took your scientific information and we did something about it 15 years ago. So that was, look how long ago. I've been doing this for 25 years and they were doing it 15 years before.
And benzodiazepines have been around since the early 60s, right?
Right.
Yeah, that's disgraceful.
Yeah, and we don't have helplines here in the United States or Canada. There was a doctor, Dr. Steve Gressett, years ago that contacted me. He's passed away now. And he said, let's start a Tranks North America, because in these groups, you see the main amount of people coming out of Canada and the US, as Heather Ashton said, multi-drugging coming out of these two countries. Just keep giving them more drugs and more drugs. Right. And I still was really not well enough to do it, and but Tranks in Australia, which is now called Reconnection, even the Australians are in the support group saying, they're not that great. Yes, they have something, but they're not. You need to listen to the patient. We're all different, Yes. And I think I mentioned to you before, I don't believe in just starting a taper. Your body is sick from these drugs. They are wiping out nutrients, and our digestion is a mess. And what if the liver function isn't good? I had a DNA test. I wasn't born with everything to detoxify properly. I did try alcohol when I was a teen, didn't like it, got drunk very easily. I always had reactions to meds. So that's a good, clear sign without even paying for a DNA test that I don't process stuff well. So I think to just even change the diet a little bit, we've seen people when they couldn't make it and went back on, and they try again. All right, I'm going to build myself up first. One of the doctors who tried 4 times to get off finally went and did functional medicine and built himself up for a year, 1 year first. And, so he's eating good, he's exercising and supplements for his body. When he tapered, he said he might have had 3 uncomfortable days. There was a difference. From 4 times before, he couldn't do it and would go back on.
I wonder what supplements he found most helpful.
So I think, because I worked with him, it is different for everybody. I think we learned with me, because I was not hit. Somebody would say, oh, I healed quick. Oh, no, I was very slow. I didn't even start to feel better till 5 years. I made a lot of mistakes along the way. One was going vegetarian. I think we need protein, and not that vegetarians can't do it. They have to make sure they're getting their protein in. And I would love to get this one person on my podcast who did an amazing job. And she also did something that Pam Armstrong later on with her clinic found out, that if you did this while tapering, not going to take any of your suffering, but there'll be no protracted withdrawal. And she did it. And she got actually better the lower she got. And she was on an opioid, an antidepressant, and a benzo.
Oh,
And
that's some withdrawal.
she didn't get sicker. She got better. But she was meticulous with her diet.
If you had it to do all over again, you might have sought out functional medicine
First.
in the very beginning.
In the very beginning.
That's wonderful to hear. That's great advice for people. And it makes sense, right? Get yourself in a position to run a marathon without a time clock.
Exactly. And again, all functional medicine doctors aren't going to be good. So whatever they recommend, and I've said this, you have to start at one of our girls who she tried everything and then she had just had it. Like that was going to be the end.
Right.
And she decided, no, all my functional medicine tests show the phase 2 of my liver is not good, just like mine. So she went back to the products that she had and literally started at the size of a pinhead and worked her way up slowly. And that's what the doctor had said to me. We fixed my gut first.
Mm-hmm.
In 3 months, I was 97 pounds at one point, got up to 104 when I started working with him. And my weight was able to come on. I got my strength back, but something still wasn't right. So later on, I did do this mucosal barrier test, which they don't do anymore. They do an oats test, which would say the shape that the liver is. We did the liver so slowly, and boom, that's when I fully got better.
So start from the inside and then start the taper.
Right. And moving a little bit. You don't ever want to move too fast. Dr. Pert, when he was alive, he ran victims of tranquilizer. He said, if you lived it to be 1 million, they'd still find a trace of benzos in your body. So you want to walk slow, build up slowly. Everything is slowly. You don't want to upset the body too much and make it dump something and you can't get rid of it.
Right.
So,
because this autonomic nervous system right now is in a very hyperactive, injured state. So you want to be very gentle, but exercise is good. Functional medicine is good. Nutrition is good.
Yeah.
And build yourself a village. And tell me a little bit about your connection with Heather Ashton.
So actually, when I was speaking with Dr. Reg Pert, who ran victims of tranquilizers, and he knew I wanted to do this whole international type of book, like how is this going on in every country?
Right.
And he said, you need to talk to Heather Ashton. So he had this number.
Oh, that's too funny. You called her on the phone.
Yeah. And I called her and I told her what I was looking for. She said, well, but Shirley Trickett, her book is out. I said, but they won't reprint it. So her publisher felt that, well, we've already put it out there. In Australia, they had done The Accidental Addict. Their publisher wouldn't print again. Well, it's been out there. They actually got funding to do research and actually had 50 patients, clients, and they followed them. And that still didn't go anywhere. So I said to her, I need something to validate what we're going through. I need it written so that a lay person can understand it, but we can take it to our doctors. So all of a sudden, within weeks, shows this packet at my house with the 3 chapters. I'm looking for 3 pages, which is what most of the doctors wrote for me. Right. And comes the 3 chapters. So, and then came the decision, let's just put it out there. I mean, what do we need mine for? Mine, which I still, people say you should do it, but I'd rather do the podcast. But yes, if she hadn't done that, we still would not have a lot of validation.
If you hadn't asked her, there would be no Ashton Manual. Yeah. Do you know that is the only way, as an addiction psychiatrist who did a fellowship in addiction psychiatry after 4 years of psychiatry residency, the only way that I learned how to take people off benzodiazepines is by looking at the Ashton Manual. Nobody in my program had even they didn't even know it was a thing. Right.
But here's the one thing Heather always wanted to make clear. When you look at the manual, she does everything in 2 weeks, which even in the UK, they taper every 3 to 4 weeks. 2 weeks is too hard unless somebody's on a high dose and they can handle it. She used to say, I don't want people to use it like a lawnmower manual, Geraldine. So we kind of put a thing at the front, which again, we know some of the doctors aren't looking. They'll look at 2 weeks and force their patients off every 2 weeks. She wanted it to have the patient in control. And, she knew that. She learned from the people that came into her clinic.
Mm-hmm. But you were very, very smart to say, we need something written by a doctor for a doctor so that the patient has credibility when that patient goes into her doctor and says, this was written by an expert psychiatrist in Newcastle, England, who has a clinic. She's an expert at taking people off benzodiazepines. This is what she's writing. So all of a sudden the patient feels believed, has credibility, has courage. And the doctor, if he's open-minded, will say, let me take a look at this. And
Right.
sure, I don't know how to do this, but I'll follow this and we can try it. So
Right.
way to go, Geraldine. I'm so thankful
Yeah.
that you
And she
called
was
her.
lovely.
Was she?
She was amazing. You could call her and she'd just chat like a girlfriend. You know what I mean? She was a very kind, very loving. But sadly, as her health went downhill, but the Americans, she's like the Americans, people would get a hold of her email and she would try to answer everybody and she would answer in a lovely form. And
Yes.
it just got to be too much. I said to her, you don't have to answer people, send them to the support group, send them.
Yes.
Well, then also in the UK, as we started the support groups, again, they're like, the Americans are calling over to the Bristol tranquilizer and CETA when they were going, or Sue Bibby she's passed away. This is how long this has been going on.
Right.
Sue Bibby's passed away. Her organization was for kids that got put on benzos and that your organs don't develop properly for all these children, because she was a child when she got put on, who then met up with Will Day in Australia. So they were trying to bring out the research for children being harmed.
Now, tell me a little bit about the benzobookrareview.com website, which has 11 benzodiazepine books on it. How did that come about?
So that came about because Dr. Grazanti, who has the computer knowledge, I don't, he said, do you know the authors of all the books? Because I was mailing the Ashton Manual out of my house and we weren't doing the other books and they were very hard to get a hold of. Either they were out of print or if you look on Amazon, somebody was charging $75.
Oh, wow.
So I said, yeah, I actually do know all of them. And so he said, write to them, see if you can get the rights. And then he set up the whole thing. He was phenomenal to set that up. And so that at the click of a button, there isn't a country I don't think we've heard from that are ordering. The two main ones that are ordered, and now it's mainly the Ashton Manual, but it was the Ashton Manual and the Accidental Addict initially, and the other ones here and there, Felicity Jones's book, or Heather Jones's book, Felicity Bilovich's book, Shirley Trickett's book. They're all on there.
There's some wonderful books. What's the book about the mother whose son dies of brain cancer at the age of 4, and some physician puts her on a benzodiazepine?
Yeah, our pill epidemic. That's Joan Gadsby, and hers is, I think, Addiction by Prescription.
I think you're right.
Right, her and her husband go together into a meeting, counseling, because Derek had passed away. I've had her here at my house, and she gets put on a benzo, and 23 years later, when she comes off, she is then mourning Derek's death.
Oh, because the grief has been suspended because she's been psychiatrized, zombified.
All those years. Yep. And then her daughter, Deb, she had 3 children. Deb develops breast cancer and dies later on. And you know what? She's like, and you're able to handle that. You don't get drugged for it. You want to feel that pain.
Right. Yes. You lose so many decades of your life when you're on benzodiazepine maintenance.
Yeah.
Now, you're doing legislation in your state of Massachusetts. Where does that stand at this point?
So I think my son and Representative McMurtry have filed for the 4th time. And this time, at any time, we could get a call, but it'll be via Zoom. And the sad thing is, well, the first time, you kind of know it's not going to make it through. It's, you're coming through, even though the testimonies were phenomenal. You sat there and you cried through all of it. And sad to say, all the physicians that came, all they did was speak about, all their degrees and where they went. And they were, no such a problem, and did not stay to hear. One of them stayed, just one. They all left, did not stay to hear anyone's story.
That's very close-minded, and how insulting.
Yeah. Now, the next time, only 2 of them come back. And again, they were specifically asked to stay and hear the stories right out of the room. Did not hear. They only hear mine because I get to go up and speak for. So right out of the room, they don't care. They bring in their lobbyists,
Don't you wonder how physicians can't know that this epidemic is going on? Like I'm just minding my own business in my addiction psychiatry office, and I am overwhelmed with calls for the past decade because the prescriptions, long-term prescriptions, are increasing at a rapid rate, and so are the dosages increasing. And people knocking down my door saying, "I can't find anybody to help me. these drugs are making me sick. Exactly
Right.
what you said. I'm developing panic attacks in the middle of the night. I can't sleep. My memory is bad.
Yeah.
I can't function at work. I'm not the same person. I can't sit still. I'm pacing. Please help me get off these drugs. My doctor has either told me to increase the dose, or my doctor has said, I can't help you. Go to a clinic, go to a rehab where they'll take me off these drugs within a 2 to 3 week period.
Or add in more drugs.
Right. Like, aren't they listening? Because I'm
No.
not seeking these patients out. I have enough people struggling with alcohol or opioid or marijuana problems. They're finding me. They're desperate, and this is a massive epidemic worldwide, right?
Worldwide. The other thing I think that's sad that you see in the groups, how many people are coming into the groups that are just being cold turkey. Doesn't matter whether you're on 10, 20, 30 years, just their doctors ripping them off. It's unbelievable. I don't even understand it.
I think it's because the doctor wants to get rid of the problem. And it's so dangerous because they could die from the withdrawal seizures and create such benzodiazepine harm. Right? Somebody that might ordinarily have a taper, long, slow taper that's successful, all of a sudden he's ripped off in a matter of weeks. And all of a sudden we've got a severe protracted withdrawal on our hands that may be lasting.
Right. Yeah. I don't understand it. I wish that, in all these years that we've done something, I wish we've made a dent. And I hate to say we still, in almost 25 years, haven't really made a dent, except for now there's numerous more books have written, more support groups, more people worldwide are in them, and we can't get the medical profession to pay attention. Some do, so I don't want to, like you, but there are others, and they know. But a benzodiazepine person who's been taken off too fast or sick from multiple drugs, they're hard. I mean, they want to call somebody constantly. They're very sick. It's that constant reassurance, which is why, we started finally, my son, when we're in at the State House, he's listening to them. They're calling him. I mean, they're desperate, for help. And he's like, Mom, you gotta, forget the way you were going to do before with the CDs. He goes, podcasts are the thing now, you've got to do it. I'm like, well,
good for him.
Yeah. Yeah.
So he's been behind your podcast. That's Benzodiazepine Awareness with Geraldine Burns that you launched in 2018. So it's 3 years in.
Yeah.
Okay. Yeah. All right. So your son really was behind that.
He is, and he's the manager. He manages everything. So, either I'm not available or he's, or, there's been illness. So that's a good thing about podcasts. You can stop. And, I get emails or messages. It doesn't from all over the world. They say, I drive around. This guy from Australia said, I drive around and I listen to your podcast the whole time. And somebody else said, I'm on the train. Actually, this was a pharmacist. He said, I'm on the train. I listen to your podcast all the time. So that's something they could just take with them, and nobody, needs to hear it. We're on YouTube. And for anybody who doesn't have a smartphone or a way to listen, but it's that constant reassurance. In fact, one of the stories on there is Scott and Stephanie. They were friends in high school, and it's a story of he was in a rehab, just yanked off his meds, and she's got him filmed like he's shaking, and she put him back on Ativan, and he was on a little bit of Paxil. She brings him into her home with her family, and she's juicing and building up his nutrition. And she actually did take him to a functional medicine doctor and building him up. They don't taper him. They actually built him up. And when she brought him to my house, he sat there as if like the living dead.
Yes.
And I'm talking, away. And I said to him, you don't believe I was ever sick, do you? And he said, no. And I said to him, someday no one's going to believe you were sick because you'll be better. And they opened up a restaurant together. He got better. And in the end, once he was fully recovered, it took 4 years. This is how slow he went to come off the Paxil. 4 years of still eating healthy so that his life was not interrupted at all. But that's what a friend can do. Just be there,
That's powerful. So say this one more time, because I think the listeners do need to hear this. Most people recover from benzodiazepines. Right.
Yes, they do.
Yes. And
so I was a long time that you could say I wasn't going to heal. So I had to, the drugs had done something to me. So yes, my gut was a mess. I had candida, leaky gut, malabsorption. That's why I really feel like I was dying. At 97 pounds, like how much more, I was like a skeleton with skin.
Right.
So now let's start working. I mean, so I finally, out of desperation, I called, a friend who now was doing functional medicine. And you don't even have to go to a functional medicine doctor to tell you. There are ones you can work with long distance and
That's wonderful.
Check them out. Some take insurance. There actually was a place here not too far that the whole building was functional medicine MDs. And then they closed, but they took insurance. It was wonderful. So I was sending a lot of people there.
So do you feel back to normal or better than you did before you started on benzodiazepines?
Well, let's see. I was 33 and I'm 66 now. So,
okay.
But I am up and on the go. I'm on 1 hour sleep, not by choice. It's just one of those nights. And, my nephew's first day of school and I had a lot to do today.
You have a lot of energy.
Yeah. So, here's my only problem. And I'm very honest with it. And I've now learned it's really not from coming off the drug. So all those years I was sick and then, recovering. My husband did all the driving. And I talked to a friend recently whose spouse died. And she said, no, I didn't do all the driving, and so she's like, and she's a nurse. She's like, I'm just like you. I have my certain places that I drove alone. But when we were together, I wasn't the one doing the driving. She said, that's from not doing it for so long. And when my husband first got sick, I started doing like all that. I was in at Dana-Farber. I have no problem going in there. But right. the highway, the speed, that bothers me.
Still anxious.
Not so much anxious, but I just need to do it more. But, my husband wants to take over. Nope, I'm doing the driving. So that's probably my only thing. And I do feel like my nervous system tells me when to slow down. I have to pay attention. So I have my little natural things that I take to keep me calm. I'll be leaving soon to go to Florida to take care of my mother. So I'll have my husband who's sick, my mother, and I just get up every morning and I take my stuff and then I'll go for a walk,
And do you take supplements?
I do.
Do you want to share any of them on the podcast or are you reluctant to do that?
I'm very careful what to say because somebody may run out and get it.
And it might not work.
And it might not work for them.
Okay. Every body is different and every brain is different. Right. I respect that.
I will say this, some of the things that like liquid homeopathics that I can start with 1 drop, 2 drops till I feel comfortable. Even after all these years, I'm careful with everything. Anything that would affect the liver, I'm always very careful. But I like to see tests to see, okay, well, what am I lacking in? And even still, if a doctor gives you something, start at the lowest dose, work your way up. If he says, well, you need, 150 milligrams of this supplement, buy the lowest and go slow,
Right. That's good advice, I think.
Yeah.
Now, your advocacy work has been filmed from 2014 to 2020 for the upcoming documentary called As Prescribed, due out in 2022. Can you tell me something about this?
So I think Holly Hardman is the director and producer. I think it's going to be a fantastic film. I mean, she got me from the beginning. Who thought we'd still be doing it years later? And I think you're even going to see all the stress that I go through during that time, that I'm not taking a drug. At one point I fell and broke my pelvis.
Oh.
I took nothing, and that's painful. But
Ouch.
I did it all natural. And I healed. Even the physical therapist coming in was like, I can't believe how fast you're healing with no drugs. And my sister, who's a nurse, broke hers 4 years before me. Well, she's pain management. She took the drugs. 3 months later, she goes back to work on 1 crutch. 6 weeks later, I'm no crutches.
You broke your pelvis and you didn't take pain pills? I just wanted to make sure I heard that correctly.
Took nothing. My sister would call every day. You have to take pain pills. How are you going to? You have to take them. I'm like, I can't walk, number one, till 10 days later we could get to a hospital. And then he sent a physical therapist in to slowly teach me how to walk again. But I said to her, I've been through benzo withdrawal. Pain is pain. That I understand. Yes. I don't want to take anything that I don't know how it's going to affect me. I don't want my bowels affected because I know how tough that is.
Yes.
To me, benzo withdrawal was worse than, and somebody would say, well, what was your pain? Like a 1 to a 10. I'm like, maybe a 15 to a 20. It was bad.
Mm-hmm. And
I'm not taking anything.
Now, where do people go to learn more about this documentary, As Prescribed?
So you can go to asprescribedfilm.com. And if people want to make donations, she's at the final stage of editing. But I think it's going to be very powerful. She's following certain people. And And then you'll see everything that went on here in Massachusetts. And I will say this, when we did legislation, the head of the committee one year was a nurse. She was a representative, but was also a nurse. And when she heard the story at the end, I said, my niece was 30 years old and, going through a divorce, was drinking. So, her sisters put her into a rehab and they sent her out on Xanax. Now, you should only just give it for the few days you're in there. She's young. She's got 3 little girls. She got in a car accident and they gave her a pain pill and she passed away. So that suppressed her breathing, leaving 3 little girls behind.
No. Okay.
So,
and again, medical error, iatrogenic problem should not have happened.
No. And it even saw it on her death certificate. Well, I looked up the drug at the time and I can't remember what it is now. And it said not to be given with Xanax. And she was given Xanax when she left the rehab. So there's a young 30-year-old girl with 3 little girls, just going through a divorce, little bit of a problem.
Yes.
Xanax isn't going to change it.
No, didn't have to happen.
Didn't have to happen. And so she actually she had Representative McMurtry call me the night before Governor Baker's opioid meeting and asked if I would come in and speak. So there was the connection with the benzos and that. And so that was pretty good because when I left that meeting, I could feel somebody behind me. And it was somebody from a health place here that they train doctors. And he said, what you said was so good. We needed that, But yet I was in the bathroom and there were girls in there on high doses of opioids and benzos. And what am I going to say to them? Because how do you get them off? They're on such high doses.
It's Russian roulette, isn't it?
Yeah. So part of our legislation is informed consent.
Yes.
Short-term reason, short-term prescription. Many are going to fly. Why are you given, a full 30-day supply with refills? That shouldn't happen.
Right.
So, or death in the family, again, just, short-term prescription. We want a symptom-guided taper because I think one of the first times we went in, they wanted the Department of Public Health to have guidelines. Well, if you have guidelines, you have to stick to it. So no way. Right. Symptom-guided taper. And the other one was because I had 3 childhood friends, all put on benzos, all on them long-term. And and one is absolutely trying to get off. She's more than halfway off. That's the one that's been on for 40 years. Another one has passed away. And the other one, she's done better. But if you're on long-term and your life you're functioning and they can try to taper, but if they can't, how much more of their lives are you going to hinder? It's already been done to them. So they need to be informed and educated. And if they can't do it, they should not be forced off.
Right.
It might be too late. Like if it was my mother,
yes,
don't leave her alone.
Your mother's in her 90s.
My mother is 93 today. Yeah.
Happy birthday.
Yeah. But when my mother fell again, because she has polio, she fell, broke her ankle back when she was in her 80s. And so she had to go into rehab till I could get there. And they put her on Ambien every night for 2 months. And when I got to Florida and they brought her in, I said to my sister, she's intolerant from Ambien. She said, well, she needs it to sleep, So I said,
it's so ridiculous, isn't it? There are so many alternatives to insomnia than Ambien, Lunesta, Sonata, and benzodiazepines.
Well, do you know it wasn't even insomnia when she was in the rehab? It was just there was so much noise. If they had shut her door,
that would have worked.
So if they had just shut your door, you could have slept.
Yes.
And so I had to bring her back to Boston, and my mother's could be a tough cookie, and this just humbled my mother. So I had to start tapering my mother for only 2 months. It took us, I think 3 months to get her off because she hurt every step of the way, every symptom, her heart, the head. I mean, I would sleep in bed with her. I did for her, she was there for me. I was there for her. Mm-hmm. I mean, the elderly should not have to go through something like that. So if I didn't know, and because that was such a short acting one, but it was 2 months, I'm like, you're getting off because she wasn't good on it. Like if she was good on it, leave her alone.
And Geraldine, if you could say something to psychiatrists right now, or any medical doctor, family medicine, OBGYN, kids coming out of med school, becoming physicians, what would you say to physicians everywhere about this class of drugs?
Right. I would say first of all, I'm not against them. I'm for the responsible use. So, if we could find all the literature that's out there, in fact, Dr. Pert had over 1,600 articles written on benzodiazepines worldwide, and there's been more since. Mm-hmm. If we can read those, if the victims of these drugs are bringing out the Ashton Manual. Why can't you read it? Before you drug somebody, there's a family behind them. It affects a whole family. I've seen some of the worst things. Listen to your patients. Just because you have read it in a textbook, listen to your patients. That's what Heather Ashton did. She was a wonderful example of a good doctor. So listen, do your own research, join a support group and see what others are saying.
I think that's a wonderful piece of advice.
Yeah.
So if you ask a person in your office to bring a family member in, and then you give them informed consent and you say, this is a medication that can help with insomnia, can help with anxiety, but it's not research supported beyond 2 weeks, 4 weeks maximum. It might result in severe withdrawal that lasts for months to years. It might harm your central nervous system. What do we say, folks? Do we want to give it a try? What do you think people would say?
They'd walk away.
Thank God.
And there are some, like I said, there are some there are some clinical studies on some of the natural products out there.
And there's cognitive behavioral therapy, CBT-I, Coach CBT-I, put out by the VA that's research supported, that works better than any medicine for insomnia. Yeah. Absolutely. Hands down, research supported. Or you take a look, like you say, you listen to your body. If I'm not sleeping, there's usually a reason. Either I'm drinking too many energy drinks, or too much, Coca-Cola, or too much coffee, right? Or I'm having trouble in a relationship, or I'm having neck pain, or I've got headache problem, or back pain, or I need to change a mattress, or there is a reason why people have insomnia, right?
Right. And the other thing is, and interesting when you mentioned the stuff in these drinks, somebody he'll always say, I was 110% healed. And then he called one day and he's in tears. He's like, it's all back, something's wrong. I'm like, well, what are you doing differently? And he's like, nothing. And then he goes, I drink this Propel water. Well, I didn't know what Propel water was. So his daughter looks it up, sucralose. So sucralose is one thing that around a lot of people with anxiety. Even before you need a tranquilizer, get off the sucralose. So the artificial sugars have got to go. They are pretty if you're going to do sugar, but that affects the nervous system. But there's honey, there's date syrup, there's a lot of things you can use. But and antibiotics, that's another thing that's thrown people into having anxiety. But the first time we went into the State House, I brought in 3 pages of how people wound up on benzos. Do you know that anxiety was probably and panic attacks, the least reason?
I know. They use it off label. They've done research for treating chronic pain. It's not supposed to be for treatment of chronic pain, for stress, right? What is stress? Everybody's got stress in their life, right? So this is crazy. I think they've been using them to treat opioid withdrawal because of the push to get people off opioids. Right. And doctors don't know how to, detox people off years and years of pain pills. So I think that's why the prescriptions of benzodiazepines are on the rise. But let me ask you this: probably the most important question that I'm going to ask today is, what do you say to the person who's listening right now, who's either stopped a benzodiazepine taper 3 months ago and they're still feeling ill, or they're in the middle of their benzodiazepine taper and they're saying, Geraldine, I'm tense, I'm uncomfortable in my own skin, I pace, I don't sleep, I have brain fog, my memory is horrible, and I have ringing in my ears, and my gut's not back to normal, and I can't focus at work, and I'm just climbing the walls. This is not bearable. When is this going to end? And what should I do? And where should I go? I'm on a Valium taper, but what should I take? Where should I go? What should I do? When is this going to end? Will I ever get better? This is what people ask me all day, every day.
That's the $1 million question. And that's why I never finished the book, because it's like, is there a magic bullet? And then you find out there isn't. We're all different. So the one thing I would say is, yes, you can get better, because there isn't a symptom aside from I did have some akathisia. I didn't have a lot of pain. I did have horrible twitching. I mean, I had like 50 symptoms going, including wherever you had a surgery, a scar, I would feel it all over again. Everything was raw and fresh. Is that you can get better. It's going to take time. I still say you can slow your taper down, build your body up. and you're fully in control. You're in the driver's seat. And I would say, not that everybody has to have support. It's so important. One of our women who she didn't have, her husband had passed away. She was alone. She had different people do different things. Now, mind you, they didn't understand the whole withdrawal thing, but somebody would drop off food. Call. If somebody had cancer, they would surround you with food. They'd make a chart of who's bringing this. We can't all eat perfectly, but you can eat simply. If you listen to Cindy Samora's story, she became homeless at one point and still kept a meticulous diet. She had a phenomenal naturopath out in Montana. So it doesn't necessarily have to be a functional medicine doctor, but digestion, I think, is important, and eating the right things and avoid the things that are going to harm you. Like, some were still drinking. I mean, you can't drink alcohol. Dr. Pert he says for 3 years. Now, I don't drink, so it's easy for me to say that. Too much coffee, not good. Sugar, again, you have the cravings. I understand that, but try to go over to something a little bit more natural, but not an artificial sweetener. I mean, and move. You've got to move. And water, Dr. Pert always said, keep the bowels going, that you want to get that going. And, there are simple teas you can do to help the body. I'm not a tea drinker, but I made myself drink some teas that you don't want to ever cleanse the liver, but just, assist. There are certain teas that, again, you can ask at any health food store, what would help? Stop making it weak. Let it get stronger as days go by. Do everything slowly.
That's wonderful advice. And do you have a preference with respect to a virtual support group, an online support group? What ones do you like, or are you reluctant to say?
Well, you know what? I look at a few of them because, I've got my husband who's sick, so I'll see some. So I'm in a lot because, I'll put the podcasts in when they come up. But so it's hard to say because they're all good. Some might be, again, because I'm not in them all the time. I loved mine, obviously, years ago when we were small.
And what was yours called?
I think it was just called, it's been so many years now, I think it was just called Benzos. But it was it originally started out at one list, then it went to Yahoo, and I think we kept the name so that nobody else would take it. I had given it to somebody else after a while when I went on to do the Benzo book review project, because every single book had to be scanned in and converted over into a PDF. I mean, people don't realize the amount of work. So the Ashton Manual is always up for free, and the paid ones go to support the websites. Everybody who has a website, they were paying out of pocket. So I sent money over to Professor Ashton's son to continue her legacy, her work.
Oh, it's wonderful. And do you have a favorite website for people trying to learn about the harms of benzodiazepines and benzodiazepine withdrawal? There's so many good ones out there right now.
There's so many good ones.
You can educate yourself, and you can educate the family.
The original one was benzo.org.uk, where the article, Ray Nemo has that site where he's got the article on there about a woman's menstrual cycle, because so many of us have been hysterectomized, DNCs, girls lost their periods. We saw all that when they came in to speak at the hearing. Right. And the sad thing is, as these girls become women, and they've lost the chance to have children. One was able to have one, and then her periods again, just so messed up from benzos. And so that was the original one. There's benzoinfo.com. There's benzosupport.org.com. There's benzo reform. There's just so many of them now.
Thank God for the advocates like you.
Yeah. I mean, who's really going to care but somebody who went through it?
Yes, exactly.
And, people think, we're all these us patients. Well, there's been so many medical professionals that have gone through our groups, and some of them don't, I remember one, she kept working and she didn't want anyone to know that she's tapering, but another one of our orthopedic doctors, he just took Xanax for a little bit of stress, and it turned his world upside down. Now, he eventually did die via suicide. And he said, I should have known on that last call. He was devastated by what these drugs can do for a short time. And I think being a doctor, maybe he just couldn't comprehend a drug could do this. Mm-hmm. And he was the most lovely man. And he said, I have a wonderful wife, a beautiful home, money, children. He's like, this is awful.
What a tragic end, and it didn't have to happen. No,
it didn't have to happen.
Unfortunately, we are at the end of the show. I could talk to you all day about this, and I just love your enthusiasm and your passion. and your tireless advocacy work. Geraldine Burns, you are one of my favorite kind of heroes. You fought the good fight. You didn't give up. And then you took your own pain and suffering and everything you learned, and you're using it to help others. You have made an enormous difference worldwide. And I just, on behalf of our listening audience, Geraldine, I honor you and I respect your journey, and thank you so much.
Thank you so much for having me on.
Oh, my very pleasure. Well, this is Recovery, the hero's journey. And thank you very much, Geraldine. We'll see you all next week.
Thank you for joining us this week. Recovery, the hero's journey, is broadcast every Tuesday at 12 noon Pacific Time and 3 p.m. Eastern Time on the Voice America Health and Wellness channel. As you wait for our next program, remember, you are definitely not alone.